and welcome to the first of our video series with Dr. Anna-Marie Wysynski. I am so proud and so honored to have her with us today, our topic being bioidentical hormones. She has been a specialist in this field for quite a while. But before we get into it, I would really like to tell you a little bit about her background. She has an amazing background, and she earned her Doctor of Medicine degree in Family Medicine specialty at McMaster University, just local down the road. Since 2003, she has had a limited allopathic practice in emergency medicine. Prior to her medical training at McMaster University, Dr. Wysynski earned an Honours Bachelor degree of Science at the University of Waterloo, followed by a Master of Science in Public Health, Industrial Hygiene and Toxicology. She did a double major. And at the University of Massachusetts was a candidate for a doctoral degree in Toxicology and Pharmacology at the University of Arizona. She is an award-winning scientist and a published scientific author. And in 2022, Dr. Wysynski has been bestowed with the highest honour of fellowship in the College of Family Physicians of Canada. How I met Dr. Wysynski is as she now runs her own practice. She has incorporated her vast knowledge and expertise to assist patients in achieving positive results by addressing the root cause of their symptoms. So in our wheelhouse, and so what as a homeopath I believe in. It's very difficult to find somebody that does that and doesn't just give you things for your symptoms. So she addresses the root cause of those symptoms and other health concerns. Since 2006, Dr. Wysynski has served as the medical director of her clinic, Dr. Wysynski Bespoke Functional Medicine, formerly Vitality Anti-Aging Centre here in Burlington, Ontario. She offers traditional as well as telemedic appointments, and it is an honour for Dr. Wysynski to serve you as an expert in your evolving health. And so we are going to push on. Welcome, Dr. Wysynski, or shall I just call you Anna-Marie?
Anna-Marie or Wizz, whatever you'd like.
Oh yes, aka Dr. Wizz. So pronouncing Wysynski, I had to practice that. So anyway, so we are going to go through a topic that I think so many women have concerns about, and that is bioidentical hormones. So let's get straight to it, and we are going to say, what are bioidentical hormones? So Dr. Wizz, over to you.
Thanks, Trish, and thanks for having me today.
My pleasure.
It's a real honor to be here today, and we've had a long-standing working relationship, so to be at this point where with something we're both passionate about is fantastic.
It is. It's just so exciting.
It's
great. I love it. Yeah.
So the hard part today is going to be containing our excitement and our knowledge, but with respect to bioidentical hormones, I think women have concerns about hormone replacement in general.
Mm-hmm.
But bioidenticals gives us a really great option for hormones, in my professional opinion.
Mm-hmm.
Bioidentical hormones are hormones that are, yes, not manufactured, but finished in the lab. They are not made from chemicals, they are made from natural sources.
Great.
And chemically, they are identical to what the body makes. So when we have a molecule, let's say it looks like this, and that's the natural molecule, the bioidentical hormone is going to look like this. Versus a pharmaceutical drug that has what we call functional groups, or added chemicals, that can look like this, or like this, or like this.
Right.
They're very similar, but they do not look exactly like this. So when we administer bioidentical hormones or prescribe them as physicians, we actually give hormones that look exactly like what your body makes chemically.
Okay, so as women, we have three key hormones. We've got our estrogen, which, if you've seen some of our previous videos, is a family of three hormones, and we're going to talk about one of them particularly. At least three.
Yes.
And we've got progesterone in there and testosterone. So bioidentical hormones, can we replace all three? Do we focus on one or the other, or do we weigh those out to create balance? How does that work?
From a reproductive hormone point of view, we could replace all three, and we could replace more than just the sex hormones that also come into play in menopause and perimenopause. So for example, stress hormone precursors can also be replaced.
Oh, such as?
DHEA,
Right, yes.
pregnenolone, the hormones that are higher up in the cascade that then give rise to the hormones down below. So hormones are in a cascade, and they start with cholesterol, which is very interesting because we often talk about needing lowering cholesterol.
Yeah.
Yes, there are reasons to lower cholesterol and keep it within a safe, healthy range. But when we look at some of the new guidelines, it's kind of concerning because when we want to drop people's cholesterol who have never had any cardiovascular, cerebrovascular disease, or peripheral vascular disease, meaning heart attack, stroke, or lack of circulation in their limbs, the problem is if we lower our hormones, because we've lowered the cholesterol, then we run into problems, including dementia, which is probably the biggest scare for most people in this common age, is they know they're going to, which is not true actually. People assume that they are going to get some form of illness in their aging years. However, we now know statistically significantly, so that means when we do a scientific test, there's statistics applied to this, and if it's significant, it means it could apply to the general population. So statistically significantly, when women and men replace their hormones when needed, they reduce what's called all-cause mortality. And that means whatever disease you could die from, you statistically significantly reduce your risks.
Right. So I've often heard when we think of our hormones, we think of them as life hormones. They are there to create life, to procreate life, and we know that we have receptors all over our body that feed off these hormone levels that we are supposed to have, definitely in our younger years, to enable us to procreate and raise our children, and those are now dropping. So we want to be able to top those up, shall we say?
It depends on the physician's approach. The way that I was trained and my approach in the clinic is to augment what the body is already making. Other physicians, so we call this physiological dosing, versus pharmacological dosing, where we just give higher doses of hormones that take over the body. So it would be just similar to a birth control pill or a one-size-fits-all remedy, like standard doses of, say, estrogel or progesterone.
So what we're looking to do with bioidentical hormones is to top up our levels to that point where we are healthy and we're active and we're aging well. That's really what you're saying.
Absolutely. There's different protocols for sure, different approaches that I will use. There's really no protocols in my clinic. There is one called Wiley where women will continue to menstruate every month. Few women want that. Once the period is gone, they fear getting to menopause, but once it's gone, they're like, don't want it back.
Done with that.
Close that door, right? Exactly. We're washing our hands. We're moving on.
We're done.
But many women understand the benefits of cycling even in their menopausal years, and we will use that protocol. But it's hard for me to say how I approach my patient dosing or my patient prescriptions, because that's why the clinic is bespoke. We borrowed that from the clothing industry, meaning custom tailored. So even though somebody's hormone levels may be similar, their prescription may be very different based on lifestyle, based on their sleep patterns, their nutrition, etc.
And of course, all of those things are so important when we talk about what we eat and how we sleep to aging well. If you don't have those things in place and being happy, like emotionally stable, so that we can keep our levels straight in our body. But I think that to have that customized approach to our hormones versus one size that fits all is critically the most important way to go. Now I want to backtrack a bit because you talked about cholesterol levels, so let's get rid of that confusion. I can see how some of our viewers might be concerned about that. So obviously with cholesterol, we've got good cholesterol and bad cholesterol. And we have those limits that our regular doctor says, you've got to get your cholesterol down. But is it my understanding then that all of your hormones are actually cholesterol based? They are made, they're called steroid hormones, which is classically not something everybody would understand. So can you differentiate when you say we need to keep our cholesterol level up what's good, what's bad, and is it the good cholesterol? We certainly don't want that bad cholesterol in there, do we? Causing clogged arteries.
Right.
Right.
So the good cholesterol and the bad cholesterol, the good being HDL or high density lipoproteins versus LDL or low density lipoproteins, they need to be in a balance. But the total cholesterol is also very important. So for example, the guidelines are getting tighter and tighter and tighter for different metabolic controls, including cholesterol. And unfortunately in allopathy, what ends up happening is we become very myopic. And what that means is that it becomes very short-sighted.
Oh, okay.
So if the physician is a cholesterol expert or a cardiologist or a general family practitioner, the guidelines say dial it in. So you get your little cholesterol binoculars out and you dial it in and you look only at the cholesterol.
Right.
One of my fortes has always been to see the bigger picture.
Right.
I love seeing the little minutia, but now I can put that into the bigger picture. And so when we look at the rising rates of dementia specifically, which concerns me, if cholesterol is too low, we cannot make brain chemistry. Depression.
Right.
Emotional health.
Definitely.
And then, people think that when women reach a certain point that we're just gone from, the reproductive egg-laying chicken to the boiling fowl and we just go to the soup pot, right? But the reality is that successful aging relies on our sex hormones. Do women in their 50s and 60s want to conceive babies? There are some who do, and then we give them, massive doses of replacement to be able to maybe carry a surrogate or something like that.
Right.
But the bottom line is that's not the normal, average, everyday woman out there. A woman wants to get through menopause with grace. She wants to age gracefully. And the goal of any hormone replacement, whether it be bioidentical or not, is to reduce our physiological functioning by about 10 years.
Ooh,
dial back.
I can do that.
Dial back the clock 10 years.
Doctor.
So your brain is functioning, your balance is good, your muscle mass is able to be created.
Right.
You have good cardiovascular health. And even though we talked about cholesterol a moment ago, and the good and bad cholesterol and the benefits, for example, estrogen controls cholesterol.
Yes.
Estrogen relaxes arteries. So two of the major cardiovascular risk factors being high blood pressure and high cholesterol, which we would call hypertension or hypercholesterolemia, are both influenced under estrogen.
Yes.
So when we lose our hormones, we lose our functioning.
Yes.
Right?
Yes.
So years ago in the Burlington Post, for example, when we first started the clinic, I wrote an article and it said that we would all love to live to be 100, unless we were in a nursing home.
Well, exactly.
Right? So the goal is to live well. And to live physiologically well so that you can accomplish and do what you would like to do.
Correct. Yes. All right. So is there ever a right or a wrong time to start taking bioidentical hormones?
This is a great question, and I think that depends on your perspective and what peg you hang your hat on.
Right.
So traditionally, we were told that from the North American Menopause Society, lowest dose, shortest period of time, no longer than 5 years postmenopausal. And if you didn't start in the first year, you weren't eligible. If you were to start your bioidenticals a little bit later, it could be acceptable, but absolutely more than 5 years postmenopausal, absolutely no hormones. Then that large study in the 80s came out, the Women's Health Initiative, which unfortunately was not a very reliable study and did not produce very valuable information. In fact, right now, as we're about 20 years past, we're starting to see recanting and drawing back or pulling back of some of those scientific publications and clarifications about the data. So the Women's Health Initiative came up with two really good findings. So if we're going to take anything forward from the Women's Health Initiative or the WISE study, so the two things that are really important is that progestin, which is a synthetic progesterone, and that's a really big key that I'll come back to in a second. Progestins were culprits in causing clotting type of heart attacks, deep vein clots, and increased risk of breast cancer. And of course, all of those are frightening for any woman. But the breast cancer piece is the terror.
Absolutely.
Now, the important key here is progestin versus progesterone. When we look at the studies, even as doctors or scientists, it is very difficult to flip through the study sometimes and understand what the investigators used. Was it progesterone or progestin? Because when it's a progestin, we know now that progestin, which used to be called prometrium, should not be used.
Yes. So really what you're saying is, with this individual approach you take to women, this customization of their, what would be their prescription, they're going to reach optimal health. That's great. So is there, just to clarify, is there such a thing as taking hormones for too long?
Again, it depends what peg you hang your hat on. So
Right.
some women want to take hormones. For example, this last week I had a woman in my practice. She's just in the first 3 months of the hormone journey, which is
Right.
the adjustment phase. And she was very flustered and said, I don't know, I just wanted this to get me through like the first little while, and then I want to do it on my own. Most women can do it on their own, and the lifestyle piece is important, but I don't think they get the same benefit. I think
Right.
it's a lot of work and dedication and constant day-to-day discipline, and I don't think most women can actually do that.
Yeah.
And yet, if we are going to live long and well, again, the North American Menopause Society used to say shortest period of time, maximum 5 years.
Right.
North American Menopause Society, as of this year, has actually looked at the data that other groups were espousing and agree that hormones, when administered well and monitored, and that's key,
Yep.
our clinic, my clinic, is very strong on monitoring.
Yeah.
We keep tabs on people. Things change, seasons change, life
Yeah.
happens,
Yeah.
nutrition changes, and if hormones are monitored, then we can keep them on going indefinitely.
I think, you know, the point that you made about lifestyle and diet and how so many of us can't do that, it is, I think it's a two-way street. Taking bioidentical hormones is definitely a partnership or an agreement between the doctor and the patient. And I can honestly say that in having to adjust my own lifestyle over the years and really watch what I put in my mouth, really be careful about getting out there, even if it's for a walk or versus going to the gym or whatever it is, and monitoring my emotional health, I actually feel better doing that. But there comes a point as you get to 60, 65, and in my case coming up to 70, where functionally and physiologically that doesn't fully cut it anymore, and hence the need for possibility of bioidentical
For sure.
hormones. So it is a two-way street. It's not a quick fix. It's a journey, is the way I
Yes.
think, based on what you're saying and what I've learned from you in the past. It's definitely a journey in which the doctor and the patient participate together, and it's a guidance, and it's, I guess,
Absolutely.
not
It's a relationship.
it is definitely a relationship, and you have to participate if you want to be well through your later years.
Yes.
You have to participate fully in that and not expect drugs or medicine to do it for you. It's all about yourself.
And this is a good point, Trish, because people think that if they go for hormone replacement therapy, that magically everything that is
Yeah.
wrong is going to correct itself. But hormone therapy, even synthetic hormone therapy, can be very powerful
Yeah.
and really turn the boat around in terms of symptomology and function. However, if we're eating pizza pops for lunch, and I'm sorry if you've had a pizza pop today, no judgment. It does happen.
Yeah.
Vacation, in my own life, my motto is nutrition doesn't take vacation when I go on vacation.
Exactly. Yeah.
And
yeah.
like you said, that discipline, it's sort of like one of those drink dispensers that you see with the stopcocks, right? You're putting all the input into the top, but unfortunately as we age, the drip gets a little bit more and a little bit more, and eventually what you put in the top may not sustain itself. Now, there are about 8 to 10% of women who have virtually no menopausal symptoms, and they sail through menopause. That's probably the lady you see driving in the sports car with the top down, full head of hair, all of her teeth, no glasses.
I wish.
Right?
Yeah. Yeah.
And that's the woman who's in that 10%, but the
Yeah.
majority of us
Yeah.
will not have a pleasant time.
No, it's I can't honestly say that I know anybody who hasn't had something in menopause, whether it's a physical illness or an emotional illness or complaints of one thing or the other. So as we kind of draw to a close here, let's address the elephant in the room.
Sure.
Do bioidentical hormones cause cancer?
This is a tough way to answer this, because if I say no, and somebody does develop a cancer on a bioidentical hormone.
Right.
So conservatively, I would say the evidence shows that the synthetic progestins are the most strong culprit in the development of cancers, specifically breast or uterine.
But they're not going to get that in a bioidentical hormone scenario.
No, but
right.
we also have to acknowledge the fact that estrogen is proliferative. That means it makes things grow.
Yep.
Progesterone
Mm-hmm.
is anti-proliferative. So you
Right.
think gas and brake pedal. Estrogen's the gas, progesterone's the
Right.
brake. When we lose our hormones at around the age of, well, probably 10 years before we actually stop
Yeah.
our periods,
Yeah.
because the decline is very long for us, but
Yeah.
and that's why it's sort of crazy making before we get to that 1 year anniversary of our last period. So menopause is a day,
Yeah, it is.
right?
Yeah.
It's a day, a single
Yeah.
day, and then we're postmenopausal. Progesterone falls about 70%. Estrogen only falls about 30%. So that means that we're in a
right.
chronic state
Yeah.
of estrogen dominance.
Now, it was my understanding, and I think I read this somewhere, that number one, new research shows that we're starting to drop, those hormones are starting to drop in some cases as early as 35.
Yes.
I do know from women I know who have turned 40, they're already starting to feel it, where we always talked about menopause kicking in, or perimenopause kicking in more like 45 to 47. And I also understand, correct me if I'm wrong, that it is actually progesterone that starts to drop first, and that's where we see the first of our symptoms.
Yes. So if we think about age 25 as being at our hormone prime,
Wow.
every 5 years the hormones start falling off for men and women, but for men it's more gradual.
Yeah.
So that's why fertility around 25 is easy. At 30 it's more difficult.
Yeah.
At 35 usually needs some support in terms of fertility medication or progesterone support to maintain the pregnancy. At 40 it gets much more difficult. At 45 women are not thinking about it for a variety of reasons, because number one, they're physiologically less capable of conceiving, but then they're also going through this insanity of this tempest of premenopause where
Yeah.
irregular periods, their mood is changing, their mind is changing, their cognition is changing, their sleep is changing, and they're like, are you crazy? Get away from me, right?
Yeah.
Hot flashes,
Yeah.
night sweats may be starting.
Yeah.
So
And-
yes, the decline is very gradual and usually on the fives.
Right. Yeah, I can actually back that up. 50, 55, 60, 65, and now 70 is, yeah, it's a big one.
It's sort of like the signposts on the highway as
Yeah.
you're driving through.
It is, it's a big change.
For sure.
And Dr. Wizz mentioned all those symptoms. We are going to come back at a later date and talk about those and what you can do about them.
For sure.
So there was one more question that I didn't ask you, I'd like to ask you before
Could
we wrap.
may I
Yeah.
finish my thought on estrogen and progesterone?
Go ahead.
So when we think about our parents and our grandparents who didn't have these beautiful options available to them, why do women get breast cancer? We either get it young, around 40, unless you have a genetic pattern that you may get it earlier. We do hear women having breast cancer at 25,
Right.
for example. But the other age group is in the elderly women's age group, above 70, 75, 80. Why is that?
Really?
Because a woman who's lost her periods at 50, with that hormone decline where progesterone is low and estrogen is high, that
Right.
breast tissue has been stimulated, so the gas pedal's still on. The gas
Yeah.
pedal's still on. So when we get to 80, we've had 30 years of stimulation of breast tissue without the brake pedal on. So it is more likely to get breast cancer in your older ages without replacing hormones. Additionally, there's a beautiful book that I read by a former oncologist from the University of California Health System, and he went back to the 1940s when estrogen was first developed.
Oh,
And
right.
the reason why progestins were developed was because the developers of the synthetic estrogen, which was Wyeth Ayers, the pharmaceutical company Wyeth, noticed that there was an increased risk of breast cancer, and they went, "Whoa, we've got the gas on way too fast. Let's develop something else to counterbalance that."
Right, right. So really stressing the importance of keeping the estrogen at the right level, because we need that for brain health, but also balancing it well with the right amount of
Right.
progesterone, not progesterone.
Progestin, exactly.
Progestin, right,
And so we
progesterone.
can talk about the effects of estrogen and progesterone later because we were focused today on other things. But
Yeah.
you know, there's so many benefits. And if a woman is going to choose to not take a hormone, or she forgets a hormone, or she runs out of a hormone prescription, I would rather her stop her estrogen any day and continue on progesterone
Oh, interesting. Okay.
than
Yeah.
the other way around.
Yeah.
And the insanity in medicine is, what do we do for women, especially without a uterus? We give them estrogen.
Yes.
And if one pump or one patch isn't enough, what do? we increase the estrogen dose. So artificially what we're doing is pushing her into a higher state of estrogen dominance. The
Right.
body has a safety, it's almost like the
Yeah.
emergency brake.
Right.
It has a safety in that the receptors, which are like locks, that allow the key to enter, which is the hormone.
Yeah.
So key goes in, does its work, key comes
Yeah.
out, the body takes the receptors away. And that's how the body copes with all these high signals of excess estrogen.
Right.
When we keep giving women 1 or 2 pumps of estrogel without progesterone to balance.
Right.
But in essence, what that does is it creates a double whammy.
Right.
High estrogen, so overstimulates tissues for a long time, and then the body takes out the receptors and it behaves as if it's estrogen deficient.
So what we're saying, if we kind of come back to the beginning, having that personal prescription with proper testing from somebody like Dr. Wizz is absolutely critical. And the testing that she does is so personal, so individual. You are going to, as I understand with bioidentical hormones, get that perfect balance so that you don't go into this stage, as she just described, post 80, and really ending up with that breast cancer. So it's a very controlled mechanism. My last and final question, and then we do have to finish. What are bioidentical hormones made of?
Bioidentical hormones come from 2 natural sources, either a wild yam or soy. And almost ubiquitously or universally around North America at least, they are yam-based, not soy-based, because of the natural estrogens in soy,
Right.
as well as the sensitivity to soy. And we know that soy is one of those 5 common allergens,
Yeah,
food
it is.
sensitivities.
Yeah.
And with the estrogenic effects of the natural soy plant, almost ubiquitously I will find wild yam-based hormones.
Great. So I hope that answers actually a very critical question for many of you who are living a plant-based life, are concerned about putting traditional drugs into your body, etc., etc. So Anna-Marie, thank you so much for that today. Very informative. And if you have any questions, you can find 2 phone numbers, one for myself and one for Anna-Marie herself, in order to get your questions answered. Please do reach out to either of us, particularly Anna-Marie here. She's more the expert than I am.
Thank
And
you.
with that, we'll look forward to hearing from you, right?
It'll be fun.
Yeah, thank you.
Risk of breast cancer. They went, whoa, we've got the gas on way too fast. Let's develop something else to counterbalance that.
Right, right. So really stressing the importance of keeping the estrogen at the right level, because we need that for brain health, but also balancing it well with the right amount of progesterone, not progesterone.
Progestin, exactly.
Progestin, right,
And so we
progesterone.
can talk about the effects of estrogen and progesterone later because we were focused today on other things. But, there's so many benefits. And if a woman is going to choose to not take a hormone, or she forgets a hormone, or she runs out of a hormone prescription, I would rather her stop her estrogen any day and continue on progesterone
Oh, interesting. Okay.
than the other way around.
Yep.
And the insanity in medicine is, what do we do for women, especially without a uterus? We give them estrogen.
Yes.
And if 1 pump or 1 patch isn't enough, what do? We increase the estrogen dose. So artificially what we're doing is pushing her into a higher state of estrogen dominance. The
Right.
body has a safety, it's almost like the emergency brake.
Right.
It has a safety in that the receptors, which are like locks, that allow the key to enter, which is the hormone.
Yeah.
So key goes in, does its work, key comes out, the body takes the receptors away. And that's how the body copes with all these high signals of excess estrogen.
Right.
When we keep giving women 1 or 2 pumps of estrogel without progesterone to balance.
Right.
But in essence, what that does is it creates a double whammy.
Right.
High estrogen, so overstimulates tissues for a long time, and then the body takes out the receptors and it behaves as if it's estrogen deficient.
So what we're saying, if we kind of come back to the beginning, having that personal prescription with proper testing from somebody like Dr. Wizz is absolutely critical. And the testing that she does is so personal, so individual. You are going to, as I understand with bioidentical hormones, get that perfect balance so that you don't go into this stage, as she just described, post 80, and really ending up with that breast cancer. So it's a very controlled mechanism. My last and final question, and then we do have to finish. what are bioidentical hormones made of?
Bioidentical hormones come from two natural sources, either a wild yam or soy. And almost ubiquitously or universally around North America at least, they are yam-based, not soy-based, because of the natural estrogens in soy,
Right.
as well as the sensitivity to soy. And we know that soy is one of those 5 common allergens, food
it is.
sensitivities.
Yeah.
And with the estrogenic effects of the natural soy plant, almost ubiquitously I will find wild yam-based hormones.
Great. So I hope that answers actually a very critical question for many of you who are living a plant-based life, are concerned about putting traditional drugs into your body, etc., etc. So Anna-Marie, thank you so much for that today. Very informative. And if you have any questions, you can find 2 phone numbers, one for myself and one for Anna-Marie herself, in order to get your questions answered. Please do reach out to either of us, particularly Anna-Marie here. She's more the expert than I am.
Thank
and
you.
with that, we look forward to hearing from you, right?
It'll be fun.
Yeah, thank you.
you.